Polyhydramnios and associated congenital anomalies. The definition of polyhydramnios is either using the deepest vertical pocket or the amniotic fluid index. If the maximum vertical pocket or the deepest vertical pocket is in excess of 8 centimeters or the amniotic fluid index is more than 24 centimeters, it's considered polyhydramnios. Polyhydramnios is said to be mild if the deepest vertical pool is between 8 and 10 centimeters, moderate if it is between 12 and 15 centimeters, and severe is if it is greater than 16 centimeters. And these are the corresponding amniotic fluid index. Now, what is important here is the associated congenital anomalies. As can be seen, when it is mild, the associated anomaly is up to 20%. That is 1 in every 5. It's up to 40% if it's moderate. That is 1 in every 3. And you can see in severe cases, virtually only 20% will be without associated anomalies. So it's extremely important that whenever polyhydramnios is detected, irrespective of the severity, a detailed anomaly scan should be done, and also a genetic counseling should be offered to the patients. The most common disorders are disorders that impair swallowing, acrania, exencephaly, and encephaly spectrum, conditions that have to do with the central nervous system that will interfere with swallowing, macrognathia, facial cleft, cystic hygroma, intestinal masses, and gastrointestinal atresia like esophageal, jejunal, or ileal atresia, and tracheoesophageal fistula. Less common are conditions that increase fetal urination, like polycontrolled diabetes, fetal anemia, the parvovirus infection, twin transfusion syndrome, and fetal tachyarrhythmias. Then other miscellaneous, we have chromosomal anomalies, trisomy 13, 18, 21, skeletal dysplasia, especially thanatophoric dysplasia, which has seen 2 cases, and congenital nephrotic syndrome. So the vertical pool here, 10 centimeters. So this is mild. But you can see there was an associated omphalocele detected at 29 weeks in a primate gravida. The vertical pool 12, that's moderate, detected in a 44-year-old gram multipara at 33 weeks with esophageal atresia. Here you can see severe 18 centimeters in a 38-year-old at 32 weeks with congenital heart disease, which led to heart failure and heart drops. Now, because this was pre ultrasound scan, and the chances that this baby will withstand even the rigors of labor was very low, so I decided to take a snapshot of the face of the baby and show the mother. And that was the opportunity the mother had to see that of the unborn baby. Shortly after delivery, the baby dies. So this is a 27-year-old at 8 months with holoprosencephaly and ethmocephaly. You can see a single umbilical artery and multiple congenital malformations. Again, depicting polyhydramnios and associated anomaly. Again, 30-year-old multipara 28 weeks with type 1 thanatophoric dysplasia with obstructive hydrocephalus. So here the problem is also effective swallowing. Another case, 36-year-old at 34 weeks, this time around with type 2 thanatophoric dysplasia with hydrocephalus. Again, you see the polyhydramnios. Look at the clover-leaf skull, the frontal portion, temporal portion, and the hydrocephalus. But the emphasis here is the polyhydramnios. As you can see here, it's not severe, but it's associated with this multiple congenital anomaly. So let's look at just a pitfall on how to measure amniotic fluid volume. This is the uterine wall. This seen below the uterine wall here, and within the amniotic fluid is reverberation artifacts. Again here, this is the uterine wall. And what is seen below the uterine wall and within the amniotic fluid is reverberation artifact represented by these cycles. So if one is going to measure amniotic fluid volume, please include the reverberation artifact in the measurement. Include this in the measurement. Include this in the measurement. If you don't include it and you measure it from here, it will be lower. So you need to measure it from here, down here, and from here up to here. So this is the uterine wall. This is the reverberation artifact. Here you can see this is the uterine wall, uterine wall. So how to measure? This is how to measure. You see this? Include the reverberation artifact in the measurement and include the reverberation artifact in the measurement. So I take a message to find out the structural cause of polyhydramnios. One needs to do a thorough anatomy survey from head to toe. Examine the brain and the spine for a cranial mesencephaly spectrum. Check for spina bifida, facial profile for macrognathia or cleft lip or palate. Check for neck masses like cystic hygroma. Look at the heart. Check for the stomach. As you can see, there's absent stomach wall here. Check for omphalocele in the anterior abdominal wall. And for GI obstruction from esophagus to the ileum and check for tracheoesophageal fistula and look at for features of increased urine production. What is key is that once polyhydramnios is detected, irrespective of the severity, a detailed animal discussion should be done and a genetic counseling should be offered. Thank you very much.